It's very difficult. Sometimes you go to the hospital, it's all 300, 400 people per day. Sometimes you don't get through, you have to stay overnight to get through the other day. 400 people coming tomorrow to the same hospital. From where I live to Sparlings is about 14 miles. So it is very impossible sometimes. Sometimes you can't afford it, but it's so expensive when you go to the drugstore to buy.
But when you go to Sparlings, it's very difficult. And even if you go over there an emergency, they run you back to your seat. Yeah, you're not getting through. And you have to go back the other day. It's very overcrowded. Very overcrowded. And we don't want anybody to turn away from the hospital. When we go, we need to see if emergency. Nobody not to run you back to sit. We want emergency right away. Yeah, and when you don't access, you have to go tomorrow and the other day. You understand? We need it better.
This area is rough. It's an area rough, man. Really rough. No hospital, and it's the only hospital. But if you catch Sparlings or Mandeville, Falmouth, we dead, Pandubia. So we really want a hospital. Really want a hospital. So we got hospital, we got Sparlings, we got Sparlings now. But if we go on the bench and sit on the bench, and by we sit on the bench, we want extra adrenaline and something that we fall and we dead. But we still want a hospital. We need a hospital, man. So we carry all people them come down here, then so we must wait. You understand?
Well, the healthcare in this area is very poor. You know, my first child born out here in 1977, and it was good. I did an operation out here, and it was good. In our district in Freeman's-Hall, Albertown area, we could run through the bush and carry our patient here. Now we had to go to Sparlings or Falmouth. When we go to Sparlings, and they're all there, and we can't get through. And sometimes patients die over there because I even take my mother to Sparlings, and she's there from 10 o'clock until 3 in the morning, and they just then didn't give her anything. And then when I take her home, they send me to take her home back, and then she died on the way. You understand? No, we want if we could get our hospital back, because there are a lot of people in the district, in the surrounding district. You have Halves, you have even Duncan sometime, and we have Sawyers, Ulster Spring, Dutch Hill. Yes, Coleyville, and sometimes and Troy, Warsop, Freeman's-Hall, Litchfield, Backwood, Woodgrove, a lot of places. You know, a lot of places need back this hospital, and we need hospital, man, because you see, all when baby mother take in, if you have baby, we have to go wait to Dickens down at Falmouth. By the time some of them reach, then they have baby on the way. Sparlings and over by Mandeville. That's when we go, and sometimes when we go Mandeville, we do the whole day and we can't get through. With the Sparlings, we can't get through. We are suffering here. We need hospital here, man. It's too long now. Well, when sometimes we have a clinic up by Stettin, and when we go up at Stettin, they don't have it there. And sometimes we come down here. When we come down here, whatever they have, they give it to us. And sometimes we don't have the money to buy, because we are poor people here. We are farmers. Some of us is only farmers. Some of us is housewife. Some of us we don't have no money. And when we get the prescription, sometimes we don't have it to fill with the money. You understand? And whatever they can do to help us, man, they help us, because we are hard worker.
Well, we don't have a good. We have the hospital, of course, sir, but we not a clinic. But we don't have a good. We don't get a good treatment, because other day my daughter took sick, and when me bring him to Sparlings, him losing 2 baby. We have to really go do the ultrasound first. After him do the ultrasound first and come back, The doctor said he couldn't do anything about it, that is over Spallings, and he lose it too, baby. Down here now, if we even come down here, we have to sit down and either we make appointment or not, and then we have to sit down here so till late. Sometimes we have to go home back. Because if we even get a prescription, if we go into DSP, if we get some medication, DSP can't do no better because what he have, he give, we have to still go buy again. So it really rough. We need our hospital. Somebody die here.
When me come early, sir, me still get through late. And sometimes me not get through. I have to end up go to Spallings, and when me go to Spallings, me have to sit down a long time to get through. And still yet me not get through neither. Me have to come home back.
So you get sick?
Yeah, me get sick very often. Yes, me sick with my nerves.
Okay.
That's the time me come down here. Me get through, yes, but I mean me come down here early and some of the time me not get through. We have to go home back. So we need our hospital for not plenty people dead because we don't have any hospital. By the time we reach the Spallings, them die.
Wow.
When we reach to Falmouth, on the way, them die. So we need our hospital. We need it for it. It's very important for us. It's more easy and it's more better.
Well, it's a bit difficult because I'm a diabetic and there are times that I need medication and sometimes I have to wait or buy it from private lab or something. And it's so difficult because sometimes we do not have the money. And another thing, there are times where you find person might sick, sometimes various time of night and thing, and you don't have the transportation to take them to hospital in Falmouth or probably Mandeville or Spalding and so on and so forth. So we would quite appreciate if they would bring it back to help the community because it's a wide community, lots of people who the hospital used to help from time to time up till now. The opening hours is about 8:30. Sometimes people have to be here from all 5 in the morning and sometimes you don't get through as well.
Very, very, very difficult. I'm telling you. Our challenges is like somebody sick and you have to get taxi all the way to Falmouth Hospital. And you could leave to the Falmouth Hospital at about like 4 o'clock in the morning. And when you reach down there, you sit down there, you register. It takes such a long time for you to get registered. And if you register like by 6 o'clock, you are there waiting to see a doctor up until in the night. Sometimes people sleep there because they cannot get any attention. And it's very, very, very difficult for us here in southern Trelawny. It's very difficult. We are suffering. Sometimes you go even to the doctor down Falmouth or Spalding and you don't get through, you have to come back home. And still in your sickness, going through same way, you don't know what to do. Because there's no, it's as if they don't really look on who come from this side much. You understand? They pay attention to those down the lower area more than the upper area. We are suffering. We need our hospital badly. I can talk because I have experience. Because even at the hospital in Falmouth, when you get your prescription and go to the pharmacy there, sometimes they insult you. Yes, you get insulted already when you go to find out if they have the medication. Because you don't wait on the number to call and you want to find out if you are going to get the medication. You go to find out from them and they would say, wait on your time and all of that. And sometimes you wait and wait and wait all the day through and you're still not getting the medication because they don't have it. So saying this to say, the medication area also is very difficult. You have to go and try if you can purchase it. If you cannot purchase it, you have no medication to take.
To tell you honest truth, I really need some help because I have a son, just 1 year and old, and he born with 3 holes in the heart and I keep on asking for help. And I wouldn't mind, I could get to Curly Brown where she can't help me, said but we really need the hospital back because we can't afford to go so far, Falmouth, Mandeville, and so forth, we go have a child. And also we want back with Marg and so forth. So I kindly ask for assistance and help. Well, he was visiting Bustamante. I get a letter to carry him. I'm supposed to go overseas, but I don't really have the money to with the passport and the stuff them and so forth.
The hospital, full-fledged hospital, begin
scaling down during the mid-80s, about 85, 86. It was officially closed down in 1992. We face a lot of challenges, extreme difficulties. I can tell you it's been devastating. You have mothers, young mothers on their way to the hospitals to give birth, whether Falmouth, which is over some 24 miles away, or Cornwall Regional in Montego Bay, or Spaldings. And I mean, they are over 30 miles away. The ladies have their babies on the road, I'm telling you, because we are desperate for a hospital to come back in Ulster Spring, even to a 48 hours, right? Where a doctor can look at the patient, and if they can stay over and then go home. That is what we're working at, and that is what we want. We are people after all. People who could be saved from minor afflictions on their way were sent to other hospitals where they die. Some of them die on the way going to these facilities. It used to cater to the entire southern Trelawny, plus part of St. Anne and Manchester. It was one of the best hospitals, and I'm not just saying it. It was one of they used to send, let me tell you something. Nurses, I was talking to a nurse, and she told me that when they want to punish them, they send them to Ulster Spring because it was so deep rural. But then when they came here, they fell in love with the place because you have some of the most hospitable people living in these parts. It is farming country. And I'm telling you, you can walk around and see, we have some of the most hospitable people in Jamaica. I mean, this hospital we're here, people don't just come up and look for them family. They would come up and visit others and have prayer and things like that for them. You understand? And work along, help to keep the place going, help to keep the place clean, and so on. And I am telling you honestly, I am willing to do whatever I can for this facility to come back, even for 48 hours. It caters to all of southern Trelawny, part of St. Anne, part of Manchester, and even people down in part of St. Elizabeth used to come up here. It was a bad decision, man, and we are angry. I mean, one angry people. I am still angry, and that is why I even though I'm so tired, I am retired, you know. But I'm telling you, and I'm happy that I'm not retired, because I'm going to be fighting tooth and nail. So we have to get together and work with whatever we can do and join with the friends abroad that we can get this facility going. We can't just work with the health fair. You have a lot of young people who are pregnant. Taxi drivers become midwives. I'm not being dramatic. I'm looking at you and telling you what happened. Even me delivered 3 babies following somebody on their way to 2 to Falmouth and 1 to Spaldings. You understand? The dispenser wife died because of such a good man. He died because on the way to Falmouth. The dispenser for this facility for southern Trelawny, because he caters to all of southern Trelawny. His wife, he was taking her to Falmouth and she died on the way. Yeah, man, quite a number of people. I might just counter your question with a question. Do you think if it wasn't helpful, people would be packing up at the health fair so much? People are desperate for health help. We cannot afford the private doctors, the private facilities. Sir, let me tell you something. Not many Jamaicans are well off. And these are mostly deep rural communities, farming communities. The least you pay going to a doctor is $2,000. Most of us don't earn $2,000 a day. Well, I am retired, so whatever. Most people don't earn $1,000 per day in southern Trelawny, and they have their families to cater to. So when a health fair is put on, you find out that people, they try to come to hear how they are and to see whatever benefit they can get. Some health fair, the people might bring out a little toiletries, toothpaste, toothbrush, soap, rags, and things like that.
Now, when this disease was going around, chikungunya, or chickpea as they call it, my daughter took her little baby to the hospital, and she was there for 3 days.
Which hospital?
That's Falmouth Hospital. And not only she alone, but I witnessed, I've gone there, standing inside the hospital there, and then whilst the baby was there crying, need help. And I went inside to help her with the baby. And the nurse looked at me and said, "Sir, you cannot stay in here." I said, "Why? The baby is crying." Now when I took the baby stopped crying, just to give her a little comfort, have the fever and stuff like that. And the nurse told me that I cannot stay in here. I need to go on the outside. I said, "But the baby is crying, nurse." And nurse want to look at me and say, "Go outside, sir. Don't stay inside here. We don't want you inside. We don't need you inside here. Go outside." She got there Sunday evening. She was there Monday. She was there Tuesday. Because I witnessed another mother was there. She had to leave her baby, go home, tidy herself and come back, and that person go home again, and because of the how many days they have to spend there. So and the nurses, they were reluctant, don't want to look after the patients. Well, this place here, it's very essential, because a lot of people have missed the hospital here. Because I too, while I was living in Johot, I used to walk it to this hospital here and get good attendance. Right? The doctor are living here, and as patient comes in, they get looked after, and they're able to go home. Because it's very much essential. People from all around come to this hospital here. But since they have closed down, people miss it so much. People died and they were going to hospital. People suffering. Maybe they don't even know what to do because of the condition of this hospital. It's really, really needed. It is essential. We love for it to reopen. Because living from here, surrounding Warstop and wait a bit, Lime Trail, was supposed to go down to Falmouth, or to go to St. Anne's Bay, or to go to Sparlins, or to go to Mandeville. It's costly, because they have to pay a taxi for $6,000, $9,000, $7,000, it all depends. And sometimes they gone there, they don't get through. While if they do is come to the Ulster Spring. There's a person in process, they would come here, they would get through and go home. And so you have so many poor people around who would love for the hospital to reopen. Very hard, especially at a time like this, where cost of living is so high and things is so low.
So you're appealing to the authority?
We are appealing to the authority to just reopen, give us the Ulster Spring Hospital. We need it. We need it, even for 48 hours. We need it, really need it.
Thank you very much.
Bless you, sir.
Good luck. God bless you.
Lord bless you. Thanks.